my channel. My name is Jazzy RN. I am a utilization review nurse and I have worked remotely for over 9 years. My channel is to focus on helping nurses at the bedside transition from the bedside to remote nursing. And today's channel or video, what we're going to do is focus on two states, Illinois and New York. These are both states that are not compact states, and help you to get a job in a state that is not a compact state. Just the FYI, a lot of these insurance companies, the major ones in particular, they do require nurses to have a compact license, and the only way to have a compact license is if you live in a compact state. And so far, I know California is not a compact state, Nevada, Illinois, I'm looking over here to my right, New York, they're not compact states. So we're going to focus on Illinois and New York today. So this job is with Molina Healthcare. You know, just go to their website and click on careers. You want to click clinical and then the state that you live in. And it'll give you a list of options of jobs in that state that are clinical. So this one is for a care review clinician, and your RN must reside in Illinois. We're going to go past the job description and job duties. Now, just an FYI, if you are lucky enough to get an interview for this job, you would want to use a job description and job duties to guide you on the questions you ask to the HR person or the hiring manager if you do get an interview. So we're going to focus on the required qualifications. So it says you must have 2 years experience, including experience in hospital acute care, inpatient review, prior authorization, managed care, or equivalent combination of relevant education and experience. Now, even though you don't have this qualifications here or experience, you still want to apply. I had no experience when I started over 9 years ago in inpatient review, and I've been doing this for almost 10 years now, and I've worked for 3 different companies. You must be an RN with an active and unrestricted license. Now, these 3 bullet points, I would say on your resume for this job in particular, try to combine all 3 into one. And you want to use the most important keywords. And then for this one, Microsoft Office Suite, I would say use a bullet point that has platforms used or software used. So let's say you use platforms used. You type Microsoft Office Suite. I would use the exact same writing here. You don't want to use Microsoft 365. You want to stick to the exact wording because most companies use ATS, which is called Applicant Tracking System. And this does not recognize concepts. It can't tell between Microsoft Office Suite and Microsoft 365. If the job description or qualifications say Microsoft Office Suite, you use the words Microsoft Office Suite in your resume. So if you want to include Microsoft Office Suite for the platforms used, if you use Cerner, Epic, ProTouch, Meditech, etc. at your job, use all the software that you use at your job. On to the next job is still with Molina. This is for a New York position. Let me scroll back up again. So this is for New York. This is a medical review nurse. I'm going to just do Control F and you see New York shows up here. So this is for multiple states, and New York is one of them, and Illinois is not. So we're going to go to the qualifications that are required. And this one says 2 years clinical nursing experience, including at least 1 year of utilization review, medical claims review, long-term services and supports, claim auditing, medical necessity review, and our coding experience, or equivalent combination of relevant experience, education, and experience. I'm going to show you what medical necessity review is towards the end of the video, and how you can edit your resume to reflect that you have medical necessity review experience. So on your resume, what you can do is type proficient. Let me get my words together here. So for your resume, what you can type is proficient in electronic health record documentation to ensure continuity of care and insurance assessment of medical necessity. I'm going to show you what that means at the end of this video. So you must be an RN, active and unrestricted in your state of practice, demonstrate knowledge of ICD-10, current procedural technology coding, and healthcare common procedure coding. Now, ICD-10, you already have experience in it, you just don't know it. So basically, an ICD-10 is a diagnosis code. So let's say if a patient comes in with hypertension, that's his or her diagnosis. There's automatically a diagnosis code attached to the word hypertension, and that diagnosis code is it's I-10. I had that one, it's the only one I've memorized. Or let's say the person comes in for illness. This is one I have memorized as well, and it's R69. But you already have experience with that, and you actually don't need to have knowledge of ICD-10, because whenever we are looking at these codes, we actually just Google it. So we just type in ICD-10 for hypertension or COPD ICD-10 code, and then Google comes back with the results. Experience working with inapplicable state, federal, and third-party regulations. Of course, you do this at the bedside already, because as a bedside nurse, you must work within the applicable state and federal regulations. This bullet point here, as well as organizational and time management skills, attention to detail, critical thinking. You actually can all trying to figure out how to combine these into 2 or 3 bullet points. And of course, you want to have a bullet point for your platforms used or software used, and you want to use Microsoft Office Suite. You want to add Cerner, Epic, Meditech, ProTouch, etc. to your list of platforms or software used. On to the next job. This is with, the name of the company is Guide Health. I noticed that Guide Health is basically based in Illinois, so all of their positions are based in Illinois. Now this one shows the compensation, so it looks like it is a salaried position. So we're going to scroll down to what the requirements are, and for this job, they want you to have 5 years experience. And of course, you must be licensed in Illinois. So that means you live in Illinois. They want you to have knowledge of utilization review, managed care processes, and community health. They want you to meet Illinois CE requirements, 20 hours of per 2-year RN license renewal. Whenever you put your platforms used or software used on your resume, for this job, you want to use Microsoft 365. Don't use Microsoft Office Suites, because the applicant tracking system will not recognize the difference between Microsoft 365 and Microsoft Office Suites. You want to use the exact same wording, because the applicant tracking system does not think in concepts, it thinks in exact words. You already have these 3 bullet points skills as a bedside nurse, so I would just say try to figure out how to combine them. Just use AI or ChatGPT, Perplexity AI. And this job has preferred qualifications, but these are not mandatory. So if you have a degree or certification in case management, utilization review, and or quality, add it to your resume. If you have an interest in clinical informatics, knowledge of population health and health disparities, or previous experience in health insurance or managed care settings. I do suggest, if your hospital you work for, or whatever company or bedside company you work for, some companies have free access to LinkedIn Learning. And you can just type in clinical informatics and see what you find on LinkedIn Learning. If you do find something that's regarding case management or utilization review or clinical informatics, take the course on LinkedIn Learning and then apply it to your resume. That way that experience will populate and will be pulled by the ATS applicant tracking system. And I would just suggest you don't pay extra money for the LinkedIn Pro, I believe is what it's called. You don't want to pay extra for that. Most jobs also include LinkedIn Learning for free. And you may also have internal classes you can take through your job that may have utilization review training internally at your job. The next job is with Fuse Health. Now I wanted to include this one because this job that I found is not It doesn't include a non-compact license state, but it does include a state that is actually an American territory, which is Guam. This is the first time I've ever seen a job for a nurse, a remote nurse, that included American territory. I've never seen Puerto Rico, never seen Guam, but I just was scrolling through this one, and I noticed they had Guam. That just really stuck out to me. So if you are a nurse in the American territory of Guam and you want to work from home, I want you to just look for Fuse Health and apply to this job. This requires 2 years experience as an RN. They want you to have 1 to 2 years experience in a remote healthcare or telehealth setting. Even though you don't have that, I do suggest you still apply. Right here it says strong computer skills and familiarity with electronic medical record systems. Now make sure you put that electronic medical record systems in your resume. So for example, again, on your resume you can put proficient in electronic medical record systems documentation to ensure continuity of care and insurance assessment of medical necessity. I'm going to show you towards the end of the video of what medical necessity is. So these bullet points here, you can actually figure out a way to combine these into maybe 1 or 2, because you already do this all at the bedside. And then experience working in a startup environment is preferred. That's preferred, but not necessary. Next job is with Springfield Clinic, and this one is a telenurse position. I'm going to scroll back up. So this is 8 hours per week. 8 hours per day and 5 days a week. They don't say 5 days a week, but normally whenever you are working remotely, it's 8-hour days, 5 days a week. It's more of a corporate environment, not a clinical environment. So this is Illinois, and the focus here is always going to be on what they require. So they want you to be an RN. They want you to have a current RN Illinois license, minimum of 3 years clinical experience, and they want you to have experience in ER. Our home health is preferred. It's not required. This one has a lot more information that I've never seen before, such as give 1 month resignation notice, which is very new to me. You're required to work every other weekend, required to reside within a 100-mile radius of Springfield, Illinois. They want you to type 40 words per minute, and so on and so forth. Now these bullet points here, this one you already have, the Windows operating systems, skills, pleasant clear phone voice, of course. You can actually combine these two to 1 bullet point. Now I want to go over what utilization management is, or what is utilization review, as well as appeals. They all kind of do the same exact thing. And your patient at the bedside, you have a patient at the bedside, but you have members as an insurance nurse when you work remotely. So let's say, for example, your member comes in with the diagnosis of bowel obstruction. Now, let's say you're using interqual. Now, there's 2 criteria that can be used. It can be interqual or MCG. I have experience in both, but more experience in interqual. All 3 companies I've worked for all have used interqual. Now, the one company I've worked for, they used MCG maybe about a year or 2 and decided to go back to interqual. I did notice that MCG, whenever you are reviewing clinicals or medical records or charts, it's easier to approve authorization with MCG, but with interqual, it takes more steps to get it approved. So let's say we just erase this and start from the beginning. The patient's diagnosis or the member's diagnosis is bowel obstruction. Now you get a faxed, let's say chart or faxed clinicals or faxed medical records of the patient's, let's say any of their history, their vital signs, lab reports, imaging, the reason they came in, any symptoms, and diagnosis says bowel obstruction. So in order for you to approve this member's authorization, because they're admitted as an inpatient, he or she must have a CT on the clinical or medical records or the chart that says they're positive for bowel obstruction. It also must show that the member is NPO with an NG tube to suction, and that he or she has IV fluids at least 100 mils an hour. So let's say all this criteria is met, and you would actually enter it into the, let's say, the InterQual system, the platform, and you approve it. You send an approval letter to the hospital and move on to the next authorization to review. Let's say, for example, this person in particular does not have an NG tube. So the NG tube is not there. He or she maybe refused it, or the nurses tried a couple of times and they were unsuccessful. So that therefore no NG tube to suction is there. So in that case, that means that you cannot approve authorization because the NG tube to suction has not been completed. So you would take this information, you would fill out a template and send it to the doctor, and the doctor will either approve or deny the authorization. And then you move on to the next authorization. Some insurance companies have it to where there's a different team that focuses on the approval and denial faxes once they're sent to the doctor. And then some teams have it to where once the doctor makes a decision to either approve or deny the authorization, then the authorization comes back to you, and you either send the approval fax or you submit a certain kind of, let's say, ticket for a different team to submit a denial fax. And you do this over and over. So it can be a different diagnosis for your next member. Let's say you review authorization and he or she came in for COPD or pneumonia, COVID, etc. So that's basically what utilization review and utilization management, as well as appeals, is in a nutshell.